And I want to welcome everybody to our monthly Aging Life Care Roundtable discussion, which is we are doing these monthly leading up to the annual Mid-Atlantic Aging Life Care Conference uh, uh, that is going to be held. And here I am going to share this. Is going to be held this year in November at the Bethesda Marriott. And what you can see on the screen is the major sponsors that are supporting this event. And one of the things that we're eager to do with these discussions is to um, uh, make them an opportunity to spotlight some of the major sponsors of the event. Now, today, we have the good fortune of spotlighting Inspīr Embassy Row, and I am delighted to introduce everybody to Sean Toomey with that organization. And not only am I delighted to introduce you to Sean, but Sean's also agreed to co-host this event with me because I may need to drop behind the curtain here and go radio silent for a few times throughout today's discussion. But Sean, welcome, and tell us a little bit about yourself and the Inspīr community. And I'm going to pull up, while you're doing that, I'm going to pull up a slide deck that you provided me that gives folks a little glimpse of the community.
Yeah. Well, thanks so much. Thanks for the opportunity to co-host this and to highlight Inspīr Embassy Row. We are really excited to be a sponsor for the Aging Life Care Management Mid-Atlantic Conference coming up in November in Bethesda. We're going to sponsor the luncheon that day. So we're pleased about that, and we'll be there as an exhibitor. So we're really looking forward to seeing everybody there, all the care managers and everybody else. As a quick description of what Inspīr Embassy Row is, it's a brand new upscale assisted living and memory care community located downtown in Washington, D.C., just off DuPont Circle. So as you can see, this slide presentation that Steve was nice enough to put up here will show you some of the visuals of some of the beautiful spaces that the building will have. We're renovating a classic hotel, the Fairfax Hotel there, into this 174 apartment AL and memory care community. It's really a one-of-a-kind assisted living community in DC. The fact that it's downtown and it offers all of the amenities that one would expect in a beautiful place like this. It's got a pool and a beautiful fitness center and a screening room. The crown jewel is like a rooftop lounge. There's steam and sauna and all these neat amenities. But it's more than that too. It's not just a beautiful space. The care, the experience, the support and safety of our residents, it comes first. And so that's something that we're really proud. The company that Inspīr is part of has a long history of providing that exceptional care for that. So just real quick, as an update, the construction is full steam ahead. We're anticipating welcoming new residents in late January. So we're right on track. And in the meantime, we've been building out an experienced leadership team who's ready to provide the care and the experience and the cuisine. We hired a great executive chef recently. So for anybody whose loved ones or clients are considering living in DC in a beautiful assisted living and taking advantage of the vibrancy and the culture the city offers, we'd love you to consider Inspīr Embassy Row. So, I don't have enough time to talk about all of the care levels and programs, but if you're interested, we'll put my contact information in the chat and feel free to reach out directly.
Well, and one of the cool things is your company has created a similar product in the heart of New York City, correct?
Correct. So Inspīr Carnegie Hill was the first. They really innovated this idea of a luxury downtown assisted living and memory care. And they opened one on the Upper East Side a few years ago called Inspīr Carnegie Hill. It's a 27-story Manhattan style building, but it's got all the same kind of amenities and finishes as as Embassy Row, and we're looking to duplicate their success here.
I love it. All right. And we'll make sure, folks, this is going to be recorded and we're going to drop it. We'll make sure that Sean and all the care managers' contact info is on the recording link so that you can get in touch with any of them. So,
Yes.
all right. Well, now here's my favorite part where we dive in and we get to know the aging life care managers. And Joanne, how about if I start with you? Tell us a little bit about yourself and the organization and how you got into this and the organization you represent.
Sure. My name is Joanne McCarty, and I have been a nurse since 1986, so very long time. I'm from New York originally. I work for a company called Independent U. We're located in Fairfax, Virginia. We do home care and care management. I am part owner of the company with my partner, Mary Beth Crossan. We have been in business since 2010. We have 12 members on our care management team. We are very nurse heavy. We have mostly nurses, but we also have social work. We have occupational therapy, and then we have people very involved in senior care for many years. I kind of stumbled into care management because I was a stay-at-home mom. I needed to get back to work, and I was working as a school nurse. And Mary Beth, who is a friend of mine, and our kids went to school together. She needed a nurse in her home care agency. And she said to me, 12, 11 years ago, we should get into care management. And I was like, what the heck is that? So all these years later, my team is amazing. Over 100 years of experience with all the years of nursing and care management. One of our care managers celebrated last year 35 years of being a certified care manager, which is, I think she must have been the first one to take the test. But anyway, we cover Northern Virginia and some of the Arlington, Alexandria, depending on, where our clients are.
I love it. And then, Jessica, if you want to tell us a little bit about your background.
Sure. Yeah. So I'm Jessica Young. I'm with Ferretto Young Care Management Consulting. My background really has been in healthcare administration and senior services for over 20 years. And then really worked alongside of several care managers over the years and finally made the leap into aging life care management in early 2020. And so that was kind of the beginning of it. And Mary Faith Ferretto, who is our founder, she founded the company back in 2008, and just her. And now we've grown to be a team of over 20, and we service Baltimore and every single county that touches it. So we have a very wide area of coverage.
I love it. Last but not least, Julie, tell us a little bit about your organization.
Yes, hi. So I'm Julie Rose. I am the CEO of Paladin Life Care. And I came to life care management when I started at Paladin. My background is in education and running prior businesses. And when I was thinking about making the change, my mother, Alice Paxton, is actually the owner of Paladin Life Care, and she founded it in 2013. And our CFO, Emily Duncan, is my sister. So we are a family-run company now. And they said, you're thinking of your next iteration. What could it be? Do you want to come take a look under the hood and see what we're all about? And I thought, well, I was an educator and an advocate for littles. Let me go on the other side and look at it. So I started out as a care manager and have run played a part in every part of the business, and I'm here and I love it, and dedicated to this role of advocacy and really helping those. And as I mentioned, Alice started the company back in 2013, and our team is very long run. Sheila Kirkbride is our COO, and she started with the company in 2013, so she's an honorary family member by now. We serve Maryland, DC, and Virginia, And we don't do the in-home work that Joanne's company does, but we've worked with them. And we serve life care management. We do daily money management. We serve as power of attorneys, both medical and financial. On occasion, guardians, conservators, and trustees. So we have a wide scope of experiences.
Man, I have to say, I really enjoy, like I said, this part of it, because every panel that we have has a different profile and a different story, and I love the unique ways that each of you joined into this this important business. And with that, Joanne, how about if I pass it to you? So, a lot of times in our audience, people are out there and they have never heard of Aging Life Care. That's why they are tuning in. You want to kick us off with, like, what is Aging Life Care, and then we'll kick off our roundtable discussion.
Sure. I'm gonna read a little bit just because I feel like I don't have that elevator speech that I'm supposed to have, so I don't want to leave things out. And I know there might be care managers or people in healthcare, but just bear with me. An aging life care manager, also known as a geriatric care manager, is a professional who specializes in helping older adults and their families with health and care needs. We do all ages, as I was mentioning earlier to the group here, is we have people who are not just aging population, but we work with special needs trusts. We work with children of aging adults. So the age part, we may need to rebrand at some point. Aging life care managers are experts in the issues that affect older adults, including chronic illness, dementia, Parkinson's. Services, aging life care managers help clients and their families identify needs, make care plans, find services in the community. They help clients and their families understand the implications of chronic illness and how to manage them. One of the biggest things we get asked is, what next? When do my parents need to move out? How do we plan for the future? We're good right now, but we need to know what's going to happen. Our background in education, aging life care managers are often licensed nurses or social workers with specialized training in geriatrics. They may also have education and experience in rehab, mental health, and dementia. All of us are members of Aging Life Care Association, which is a national organization. They also offer certification for our profession. It's not mandatory to be certified, but most certainly everyone in our company who's eligible to be certified is certified, and that just gives the clients that we work with a little extra reassurance that we're following a code of ethics and a code of standards. We're not just out there, saying we worked with our grandmother who was aging. We are trained, and we're committed to the clients that we work with.
I love it. All right. Well, Sean, what do you say we jump into the roundtable now? And I'm super curious at what our aging life care managers are going to share with us. But also, folks, one of the best things about these discussions is that you're open to ask a question. And so, and actually, you know what? Hold on. I was like, boy, it seems kind of quiet, and I didn't have the chat open. So, folks, can you now see the can somebody drop stuff into chat just to make sure? Okay,
There
good. Okay, there we go. Okay, so definitely feel free to hit us all up with questions. And the other thing that I want to say, the positive aging community, our audience has expanded. We're, got people all over the country now. And I know our care managers are from the Mid-Atlantic, but this is a great opportunity to just get insights on anything, regardless of geographic area. So don't hesitate. I don't want anybody to think that just because everybody on the screen is from the Mid-Atlantic that you can't ask a question about caregiving in Oregon. And I always bring up Oregon because we seem to always have people from Oregon on these discussions. Okay, well, let's see. Joanne, we just heard from you. How about we go around the horn here again? Jessica, tell us is there anything that you'd like to share to kind of kick off the discussion, like any trends, any case studies, or anything that you think might be of interest to our community?
I think, of course, the biggest trend, and I know it's been covered a lot, is the whole solo aging and preparing and getting ready. So that has definitely been a huge turning point, I think, especially this year. It just seems like it's really starting to come out more. There's more books being written about it. Some of our actual colleagues in aging life care management have written wonderful books about it. So I think that's kind of the hot topic, just because a lot of folks have gotten their parents through a crisis and now they don't want to put their kids in that crisis. So they're kind of looking forward to that planning piece. So I do know that that's been a hot topic. And kind of on the other side of it, we've been dealing with a lot of hospital discharges that have not been is well planned out, and families call really stressed and in crisis over situations like that. So those are, we're kind of seeing the positive side of pro-aging, and then on the other side, we're kind of seeing some of the crisis situations still happening.
Yeah, and Julie, on the solo aging topic, Julie, when you were giving your introduction, you were talking about powers of attorney, I think. Did I hear you correctly on that?
Yes.
It seems like anytime we have a solo aging discussion, there's people in the audience that are like, I don't have anybody in my life to assign these important roles to. And I'm always suggesting that, hey, why don't you start with giving an aging life care manager a call? Could one or all three of you like to sort of comment on what that looks like when a client comes to you that doesn't have anybody else to care for them?
The interesting thing is that it's also not only solo agers that come to us, but it's also people who maybe are disconnected from their family, or their families live their lives a little bit differently, and they're saying, I don't know if I want to make sure my wishes are taken care of. So when they have a third party kind of professional, and when we serve as power of attorney or successor power of attorney, get to know the client and know intimately what their details are, how they want to be cared for, do they have a DNR, and all of those types of things. So I think it's very beneficial to have somebody on your side that knows who you are and is not in that role of judgment, but is in that role, really that advocate for anybody, financial or medical, split up. If I can give you a quick story of what I'm just going through recently with one client. She happened to be a solo ager on the younger side, was still teaching, hadn't made any plans, and suffered a debilitating stroke. And her friends jumped in because they were the emergency contacts from when she had gone on vacation, and they jumped into the role. And unfortunately, she's had to be in skilled nursing for the past number of years, but also had a condo with condo fees and all of these things. And the friends just didn't have a heart to cut off, saying, listen, you are here. This is the reality. Just every time she would get emotional and push it off and not want to have the discussion, they didn't, they're their friends, and it's coming from a place of, caring for the person. And sometimes you have to have, as a life care manager, kind of harder discussions with somebody. And so they turned to us, and now I've become the financial power of attorney. And unfortunately, they came to us at the end of the road, where now the condo has to be sold, monies are running out. And had we been in place earlier, we really could have had more, saved her the money, helped them all work through the trauma of this time, and really given them the advocacy on both sides to help her through this. So it's kind of like this last minute thing. So I think what Jessica was saying with this people coming forward and getting help from, from other managers, just having that guidance gives a peace of mind ahead
Yeah.
of time.
No,
So,
really good stuff. Jessica or Joanne and Jessica, do you want to sort of share some insights on how your practices, maybe any different things or different elements in working with solos?
Sure. I think, well, with solo agers, the generation of people that are in their 80s and 90s typically didn't share a lot of their personal and financial information with people. They just figured that they'd have enough money to last till they passed away, or people are just living longer now. So they do run into the problem where they don't have anybody, or not just the solo ager, but even people like Julie said, who have kids. Parents didn't talk to their kids about end of life. My own parents didn't talk about it. They're like, don't worry about it. You don't need to worry about it. You're still my child. So as an aging life care professional, we're that objective person. We are there to advocate for the client themselves. And, we do have those very frank discussions, maybe not the first time we meet them, but soon, to know what their wishes are. What do you want the end of your life to look like? Do you have a place you want to be buried? Do you want to be cremated? What do you want your funeral to look like? Who is going to make that decision for you at the time? I have a client, was my first care management client, that we had that discussion when she was in hospice, about what song she wanted at her funeral. And I read a reading at her funeral, and she was able to pick all those things out. I mean, it makes me think about myself, and not burdening your children with things like that. It's not a burden, but why not plan for those things? You can plan for it and tuck it away and just have it all there for when you need it. You don't, it doesn't have to be imminent. You just have to have a plan. And I think that is, what aging life care is about also, is having a plan, bringing these things to light that you might not have thought about.
Yeah. I heard a couple things in there that were interesting. First, the word non-judgmental. I think Julie used it. That's, in my experience with care managers, that's what's so beautiful about the relationship, is you're able to have these conversations with adult children and the clients themselves, that they probably struggle to have with each other, to some of the points that you were just making there. So I love that. And the other point that maybe we can touch on a little bit is the financial aspect of it. So it's funny, we often don't want to spend money on things, right? We don't want to do that because it's going to cost us money. But like most things in life, when you invest in good planning or a care manager or whatever the investment is, it ends up saving you or making you money in the long run. And Julie gave an example of that a little bit earlier. Either any of you have a story about or a situation where you can see how your services were able to help the family, similar to Julie's? The investment in a care manager allowed you to not have to sell your condo at the end of life, for instance.
If you go on Joanne, I think Joanne was talking about, just that pre-planning. It's
Pre-planning.
Besides that, but it does give, and I'm sure we've all experienced, like a peace of mind after somebody kind of faces those things, and just knowing that they've taken it. It does give a peace of mind in that. And then you can also, when you're making those plans, then you create a burial trust, and you can buy, then those things have already been taken care of, and they're taken, it's tied away. So it's a stress that you don't have to put on for your family, or thinking about how much is it going to cost them and their time. It is laid out, which is, the peace of mind is priceless.
Yeah. It's kind of like that crisis versus planning, when you go into a crisis mode, it's just so much more stressful. Let's see. And by the way, audience, please feel free to continue with your questions if you have any. One thing, again, in my experience, I come from a home care background, and now I'm in the assisted living business, which is a wonderful transition here. But I've had a lot of experience with hospital discharge problems, and that is something that you probably know best. And so maybe we can talk about how your services can really assist families as they start dealing with hospitals and then having to come out, go home, go to rehab facilities, et cetera. Somebody want to take that? Maybe Jessica?
Yeah, that's fine. So I think, and again, some of this is going to go back to that whole pre-planning thing, right? You know,
Okay.
because we always say the earlier you get involved, you know, a care manager, the better off it will be because we're that safety net, right? Like we're ready. If you end up in the hospital, we know what medications, we know your diagnosis, we know your situation, we know your wishes, like we know all these things. But that's not always the case, right? So sometimes it's Friday, 5:30 in the afternoon, and the hospital walks in and says, okay, patient, you have to leave right now. We've set everything up for discharge. As terrible as that sounds, it really does happen. I mean, 3 Fridays ago, that happened to us, and the person actually was a solo ager, had not engaged a care manager prior to that, and was just there and kind of was chatting with her roommate in the hospital and said, "What, you have an aging life care manager?" And so she immediately called us. And again, Friday, it was like 5:30. Can you help me? They're sending me home. I'm terrified to go home because there was nothing in place. And so even situations like that, whether it's your mom that's being discharged and there's no plan, or you're alone and you're going to be going home by yourself, it's a scary transition. And care managers were there to kind of make sure it goes as planned, as smoothly as it can be. Supports are in place, or even help file appeals. Because in that situation, we had to help file an appeal with the insurance company because we didn't feel that in that moment she was ready for discharge. And so that is part of care management too, being in that hospital, advocating and trying to help them make sure that they feel safe and secure.
Yeah.
I would say also it's so important for people to know that we are, at least in our company, and most care managers are available 24/7. And that is another peace of mind, that if your children are going on vacation and you, God forbid, something happens and you need your loved one goes to the emergency room, we have a current med list. We have all those lists of, health related issues, past medical history. We work with clients that live at home, and we work with clients that live in assisted living. And you think if you move someone into assisted living that they should be sort of set, but that med list is another thing that's invaluable. You go into the hospital and they might be looking at your med list from the previous visit, or they maybe not know what your med list is, even though they just doesn't make it into the hands of the doctors and the nurses. So that's, somebody, and then you've got the family or the significant other has that person at the bedside who can communicate with them, like, yes, they're being admitted. No, they're not. They're doing blood gases. They're doing blood cultures, whatever the information is. And then the transition from the hospital to, can they go home? What makes it a safe discharge? Do they need home care? Are they going to go to a skilled nursing facility? We can make recommendations as to which communities are better than others. So there's lots of information in all of our toolboxes that we carry with us. That's just my 2 cents about going to the emergency room.
Yeah, you can't schedule an emergency, unfortunately. So we try all the time.
But you can be there. You can be there physically in the ER with somebody if they're a client of yours, and you're available 24/7, as Joanne said. These are things that give families like an incredible peace of mind as they're navigating like our very complex health system.
Right.
And that's at the hospital.
Yeah, and an important note is that an aging life care manager can be there. If somebody's in a assisted living, they will get there, but they don't have somebody to stay with their resident at the hospital. There's not that advocacy, right. And us in our role can be there, as they were mentioning. And I think a lot of people don't necessarily think that, you're in assisted living, my parent, my loved one, whomever is safe and they've got that oversight. But when they go to the hospital, especially if somebody has some cognitive decline or something like that and really can't advocate for themselves or whatever trauma they're experiencing, they're not necessarily intaking everything that the doctors are saying, so the family calls and they're like, well, they said something, but we have no idea. So
that's the role. I mean, that's what's so beautiful about this, the existence of care managers in my mind. Different providers that are on this call, whether you're an assisted living community or a home care provider or something else, some of those are the cornerstone of a person's sort of care and situation as they age. But the care manager is sort of a comprehensively coordinating all of that, which I think is like beautiful. And you have the resources. I think that you touched on some of the resources that you're experts in your particular areas, where regardless of what a family needs, you can help them find vetted and trusted partners and providers for those things. Is that a fair statement?
Mm-hmm.
Yes, definitely.
Totally.
And one of the things that I mentioned when I was talking about, care managers and our code of ethics is that one of our code of ethics is that we are financially aware of what's going on. We don't need to know what's in their bank account or want to know details, but our services are expensive, and we can talk about that. I did see a question pop up in the chat about the cost of services. Very expensive for our services. Most of us charge an hourly rate. I'll start by saying our hourly rate for care management is $175 an hour, plus travel and mileage from our office to where we're going. So either to the client's home or to the hospital. And so we are always very aware of that. And that we try to be as cost effective when we're doing our time with clients. We bill in 15-minute increments. Some companies bill in 6-minute increments. Typically, if it's a quick phone call or an email, we don't even charge for that. But if it's more than 15 minutes, we do charge for it. But, understanding that each agency charges differently. Some agencies have a retainer that they charge and they work off that. We don't do that, but I think everyone else could sort of chime in as to what their services cost.
That's always it's something that people are interested in learning.
Yeah, so we are, it's the same hourly, billing rates where we range anywhere from $164 an hour for a daily money manager to our nurse care managers at $207. We do bill in the 6-minute increments, and we have a retainer, and it's more for those unexpected emergencies or something, that run in those cases. But and we bill, and I'm not sure about everybody else, but in 2-week cycles, because usually there's so much activity going on, and by the end of a month it's hard to track and keep everything. So we invoice and provide notes, which I know a lot of other people do, and then we have different fees for when we are serving in a legal capacity, which I'm happy to share.
So it varies a little bit based on the services you're providing. That's interesting too. It's not just a flat rate. And Jessica, how about you?
I would say the same thing. Yeah. I mean, it depends on the services. So we don't do daily money management, but we do level of care assessments, and for Maryland, so 3871Bs. So that's where we send the nursing team out and do these assessments. So that would be billed differently. We also do we do capacity assessments for guardianship cases and things of that. That's billed differently. So in court, sometimes we get called in to be expert witnesses for different things. So that's charged differently. So some things are packages, some things are as needed hourly. Again, I think all of us, because we're all kind of in the same area, it really depends on the service that the client is using. But yes, we can do as little as 15 minutes too. So that's pretty common. Either 6 or 15 is, I think, pretty standard amongst the groups.
So let's stay on this for a minute because there are some questions in the chat here. So if you don't have necessarily the means to pay 175 or $200 an hour, but you really do need this kind of care coordination or assistance like that, do you have any suggestions on how people that might not have that accessible, or how do you work with families that may have a lower budget for that?
I've
Joanne?
talked to certain people over the years. I feel like doing this for as long as I've been doing it, I can certainly get a little bit of a vibe from people when I talk to them, when I say the cost. I will talk to people and do like a half an hour consultation. Sometimes I will, you don't want to give up what our secrets are and give the value of our knowledge base, but you can just kind of tell when people really need something and they just need resources. There is ElderLink, which is a care management that is through the Community Service Board. That's a free service, but they really just give you a bunch of resources, which is great. But I've given it to younger children. It seems that's my biggest sort of what I feel like if I have a bleeding heart, it's going to be a child in their 20s or late 20s, early 30s who really doesn't know. This is not the time when they are used to dealing with their parent who's in crisis. I'll give them as much kind of information as I can give to them, and maybe a husband and wife. So I will do some free consultation, some pro bono work. That would be my answer.
Are there other resources? I mean, ElderLink's a good one. Are there others like in the community that people could go? I mean, they're not going to get necessarily the level of expertise that you all offer, but at least like a guide to point them in the right direction.
In Maryland, I was going to say we have Maryland Access Point. I mean, that basically is like a free referral service. So you would call and say, this is what I'm dealing with. And then it comes down to here's some more resources to call, right? So it might be, we'll call Alzheimer's Association or call any Parkinson's Association. So sometimes it's just calling that main number and they'll give you some additional resources to connect with. And sometimes there's grants out there or things of that nature that people can apply for. But we also do free consults, and yes, 100%. Sometimes I get, just kind of give away. I feel too like that, that bleeding heart, as Joanne mentioned, you just feel, and yes, it's expensive, and
you can't do your job without having a big heart, for sure.
Right. Yeah.
And to your point, to the Maryland Access Point, and I think Medicaid may provide some level of care management as part of their benefits and things. I'm not 100% sure, but the Maryland Access Point is probably the right place to go in Maryland.
I mean, and that's what I was going to say is that most, the local governments have their aging, their departments on aging that can be helpful. And as Jessica mentioned, in some cases there's grants available, but I think all of us give away, some of our time, and our clients become families too. So we've had clients since, from back in 2013, and when their funds, their life outlasts the funds, or their needs outlast, they become part of our pro bono clients. And we don't just, we continue to serve our clients and not just let them fall off. So I kind of, and I'm sure that happens in a number of other aging life care. So sometimes
I'm sure. Yeah.
That's a good discussion. Good discussion there. Hopefully that helps some of the folks that were posting questions about that.
But also, if people might not be aware of that, and for our services, we have nurse care managers, and I know Joanne, you all have a lot, but the nursing pieces you can put to your medical cost for your taxes. So like where our client care manager and daily money management, you can't use for taxes, but we at the end of the year will give a summary of like all the nurse care management pieces in there to help a little
So
bit.
you can use, okay, your medical
And-
expenses. Yeah.
And
Steve, welcome back.
Oh,
yeah. Well, on the topic, I know you all have been talking about affordability, and I see the chat, and I not too long ago, I had a conversation with somebody who they cared for their aging in-law on their own, and then they had interviewed care managers, but everybody thought it was going to be too expensive. And then when it was her parent, she was just at her wit's end. She did not want to do it anymore, and she used the care manager, and she said, gosh, it wasn't, in the scheme of things, it wasn't that expensive because I was only paying for feedback and guidance, and when I was really at a loss, and I felt like I had an advocate in my corner, you know.
Yeah.
right. That the clients get our, our phone numbers. And a lot of times it's, there's the planning client that's calling to plan for the future. There's the crisis client that's calling because they're in it right now and they need things fixed. And then there's the consultation type thing. I mean, we require an in-person assessment with all the clients that we meet because we want to get to meet the person, see them, see the environment they're living in, see what their capability is. But they might be fine and they might not call us for 6 months, but we will be checking in with them every month or whatever the agreed upon arrangement is. There's no real like rules where we have to see you every month or something like that. If you want to check in with a phone call or an email every month and just let us know, if you've had a medical event or a fall or a new medication, or like I said before, your kid's going away for a vacation and you want somebody to check in with, but the consultation type piece of our work is great. And it can be just a 15-minute phone call.
Of all the referrals I've ever made to a care manager, I've never had somebody say that wasn't worth it. The investment, going back to that conversation, long-term financially, it makes sense.
I dropped off momentarily, but have you all talked about the hospital discharge? I know that was did you have, okay, you had a conversation about that. Okay.
We touched on that. We did touch on that. One of the things we haven't talked about, I'm sure there's a number of these folks on the call, are that sort of sandwich generation of people. And I'm sure you talk to a lot of those, the people taking care of kids and aging parents. Maybe,
would any of you like to talk about that a little bit?
I mean, again, I'll say that, that the aging population is living longer. The children of that population are still working 40, they're in their 40s, 50s. Some of us waited longer to have kids, so we still have kids in college or kids at home, and they're working full time, and they just, they don't know what to do. They go home and they visit their parents for a holiday or for summer vacation, and they're like, oh my gosh, like they haven't been getting the mail. There's sticky notes all over their house. What do we do? Clarifying the whole, this is covered by insurance, this is not covered by insurance. Did we answer? Somebody asked about long-term care covering for care management. I saw in the chat.
Oh, that's a good question.
Oh, that's a great question.
Yeah. What is that?
Some long-term care insurance policies will cover for parts of care management. Like Julie said, if we're doing like medical things, nursing, like if we do medication management, so we fill medication boxes, or if we're doing anything to do with like meals or anything with activities of daily living, mobility, things like that. So we can put that into our invoices. So some long-term care, but that would be a question to ask your long-term care insurance company. But just like navigating long-term care insurance, I mean, just getting that policy activated is, some families are saying that that they have, their parents have it, they're not really sure, but it's, the policy is 20 pages long, and activating it and all that takes a lot. And sometimes it's just answering questions, or sometimes it's doing it. And that piece of taking that, what can I take away from the sandwich generation? What can I take away from those kids so they can just be son and daughter, granddaughter, whatever, rather than being this nagging person. Let us be the nagging person. Let us be the one that's saying, maybe you shouldn't be driving anymore, or how can we accommodate that you're not driving anymore? What things can we do to help? So the visits that these kids are having with their parents is bringing them a cup of coffee or taking them out for lunch rather than taking them to a doctor's appointment, or having that discussion about, I don't know, moving all the area rugs that are in your house that you're going to slip and fall on and break your hip. Those kinds of things. They'll take it better from a professional than they will sometimes from their own children.
That going back to that non-judgmental, hard conversation piece. It's great.
Well, and I think that's the point of it, though, is having that respect and giving the client, the person that we are, the dignity, because aging it's not a fun, we're all getting older, right? And so it's, and you have just like you were saying, the kids want one thing for the parent, and the parent wants somebody else, and just saying you are still, just because you're older doesn't make you you're in charge of your own life. You've lived it, I've had clients who the children have said, she's not eating any broccoli, or she's, she won't eat, she only eats mini muffins. And I'm like, well, she's 96 and she's done pretty well. So now I think she can eat the mini muffins, and, maybe we can sneak in a veggie muffin every week if that'll make you happy, but go back to being the daughter, as Joanne was saying, like take that stress off the other side of the family too.
People get so caught up in that too. Where they don't even realize that they have stepped out of the wife role, or they've stepped out of the daughter role or the son role. And, in those conversations where they call and I don't even know what else to do. And you say to them, we can help put you back in the role of wife or son or daughter or whatever that is. And that's almost an aha moment for them. Like,
exactly.
They hadn't even thought of that, where it just got so blurred, where Joanne had mentioned bring coffee instead of bringing a stack of papers and talking about long-term care insurance. Here, let's drink some coffee together and chat about the grandkids, kind of thing. So I really think that's kind of where, when a person that sandwich generator has that conversation with us and we say, well, we can get you back in that role. And it's like, wow, I hadn't even thought of that. I mean, I had a consult with a wife recently, and I said, well, we got to get you back in. She's like, wow, like that just was a mind blow for her, because she's been in caregiver role for so long, it hadn't even crossed her mind.
That's the other thing. The caregiver suffers sometimes, and they're so worried about the client, let's just say, or the person that needs the help, that they don't take care of themselves. And that's one of the other hard things to say is, I know you want to do all this, but what happens if something happens to you and now your husband or your wife is left without you and you're in the hospital? What is this person going to do? Because they're like, well, I do the driving and I know they don't wander because I keep the door locked. Well, there's going to come a time when they might walk out the door and you don't know that they walked out the door. Everybody's trying to we do it because we do it out of a sense of love and responsibility for the people that are part of our family. But, sometimes it takes a care manager to say like, well, that's great, but that doesn't know, because we've seen it happen before where the husband passes away and the wife had dementia, and now there's no plan in place there, and there's no child. Like, at least pick a place where they could go. Can you afford caregiving at home? All, the kinds of things that we can kind of plan for. I will just say one case study that I work with, a woman who's 94 in a community, and she was in assisted living, and the daughter would drive an hour to visit the client, her mom. And it was not a great visit, but she was visiting her mom. And it came time that the mom needed to move to memory care. And then she struggled. I should move my mom closer to me because, then I would see her more often. But the thing that the daughter never thought about was, well, just move your mom to memory care in the same community. She's already knows everybody there. They already know her. It's a familiar setting for her. The only thing she has, if you move her to where you live, is you, which is great. that she's there. But then the burden is more on, and burden is probably not the right word to use, but then you would feel guilty, or you'd feel some sense of responsibility. Well, if my mom is this close, I should see her every day, rather than just keep the same routine that your mom's, that you had before. Your mom's used to seeing you once a week, and it works for you and your schedule. And the daughter had not thought of that before.
Yep. These things are so, aging is a very difficult thing. And when you're in this generation, having all of these things swirling around, it's hard to see the forest through the trees, as they say, right? So it's like when you talk to a aging life care manager and you put it in that context, that aha moment happens. I think it's like, you see it so often. Really, really good stuff. There's a couple of questions here that I want to get to before, so I don't miss it. They're a little off this topic, but please, if we have more comments on this, don't hesitate to do that. So Jonathan says, I'm a senior orphan on the West Coast. Welcome to the conversation, Jonathan. How do I find a senior care manager?
So
ALCA website. Yeah, so the Aging Life Care Association website, which is what the association is that we all belong to, you can go in and type your zip code and it pops up all those that are in your area. So you might have a list of 10, and you can put a radius of 5 miles, 10 miles, 20, however far. And it'll pull up all your options for that area.
there's a button up in the corner of the website that says find a care manager.
Yeah.
And then you can put in your zip code, and then you can look at 25 miles, 50 miles, and it'll also tell you a little bit about our background, how long we've been members, things like that. So that's a good way to
Is it alca.org? Is that the right?
I believe it's
aginglifecare.org.
aginglifecare.org. Steve, could you put that in the chat there?
Yeah, that's
that would be
the
great.
kind of.
Yeah.
And there was another question. Would an aging life care manager help vet a housekeeper or a cook? Would that be a service that somebody could do? Maybe,
Sure,
Jessica?
definitely.
And you know what? I mean, that's somebody who is planning ahead. And the thing that I like about that is that you're developing a relationship with an aging life care manager in advance of a crisis or something like that. I quite frankly, I think that's a great way for people to maybe get started, is get a little evaluation and get some assistance in finding household care.
Right.
Yeah, that's something that, is part of our whole purview, is helping find the right in-home care company, helping make sure that you're meeting your needs, helping find, even when you talk about an in-home, cook or a meal delivery service or a nutritionist, if you're, trying to be, proactive aging.
Yeah.
We also recently started a program called Empowered Seniors, where we have an initial one-time setup fee where we do the assessment and everything, and then we check in on agreed upon time once a month, once quarterly, and those different things. Or when a question comes up like, hey, I need this, then we have that history. And I think there's a number of companies that are starting to do programs that are similar to this. So it's not, maybe you don't need the full thing, but planning ahead, you're like, I want to have that person in my corner. That doesn't take it to the step of maybe necessarily needing a power of attorney, but even somebody who has the power of attorney has a friend or whatever, they're like, oh, I'm connected with whichever organization, Paladin, whomever, and they can be a resource even to their loved ones. So there's lots of different ways, but
It's
a good one because you got to
I
find.
I know I've been jumping in and out here, but there's quite a few questions about becoming an aging life care manager. Did you all address those?
No, that was going to be.
There's a lot of folks talking about making a career shift and should I become certified, this, that, and the other. I know we could probably do a whole hour on this, but what are some of your thoughts on folks investigating this as a career path?
There's a lot of information on online about how to be a care manager. You don't have to be certified. You don't have to do a lot of things, but I think it gives us a little more validation and in what we do. But like for most care managers, they're either a social worker, a nurse, degree in gerontology. Sometimes we have executive directors or administrators from skilled nursing facilities or assisted living facilities, some knowledge of what, is involved with working with older adults. But there are also people with business backgrounds with, it's really knowing your resources and knowing how to connect people to different things. Each care management company probably has their own orientation that we do. There is a certification exam, but you have to practice under a licensed social or a certified care manager for 2 years in order to just sit for the exam. So, in our own agency, I mentor people, or my peers we mentor each other. But when I first started, I didn't have any. I was the only one. So I had somebody else who was a certified care manager. We worked out something where I met with her and we went over plan of care, because part of the certification process is you have to do peer review and you have to discuss to make sure you're making the right decisions, because people are calling us for these big decisions. If somebody's asking me what's the best assisted living or what's the best home care or even what's a great housekeeper, I want to make sure that the referrals that I'm giving have been vetted and that I'm not referring somebody that's, they're putting a lot of trust into the decisions that we make. So there's knowledge of medications, there's knowledge of diagnosis, we have different people in our practice. That we have nurses that specialize more in psych background. My background is cardiology. We have an OT encompasses so many different things. So, you just got to be willing to find a company that would be willing to pick your strength and orient.
And wouldn't you say, because I'm looking at, we have several questions on this with varied backgrounds, folks, one thing that I would do is go to the Aging Life Care directory or Positive Aging and just call a few places. And for the most part, if somebody calls you, unlike calling a hotel to try to get a job, you all in your practices, somebody will respond and let you know if you're hiring or, what have you.
I get a lot of those calls. Sometimes people, so those questions that are popping up, sometimes people just call and just say, hey, I really am thinking about doing this. What should I do? How do I do it? I've had plenty of those phone calls with people who just kind of reach out to see.
And it's a lot of it is finding a match for all of us.
Absolutely.
Employers are looking to bring people in that fit with their culture and vice versa. And so I would recommend very open bunch, the Aging Life Care managers.
I found that they're so collaborative. If it's not a good fit with somebody, they'll say, you might fit with my colleague, Julie or Joanne or Jessica. That's really true.
At least in Northern Virginia, you can't refer somebody that's not good. We have our strengths, we have our weaknesses, we have people that are better at special needs trusts. We'll call another agency because we want to, again, not charge a client that lives in Front Royal for us to drive there. Why not refer somebody that's out closer to that area?
Right.
This is a high level question, but I always love it when we get something like this on these calls. And I'm looking at the clock. We're about out of time, but because we got 3 care managers, let me read you this question that somebody has. And if you have insight, that's great. And this person says, I'm so disappointed with long-term care communities, ADLs, which is activities of daily living. I have terminal cancer, a weak skeleton, an old-fashioned step-in tub. I'm frightened of falling. Because I can sponge bath, the ADL of being able to bathe does not qualify me. Am I confined to sponge baths for the rest of my life? I've got some ideas on this, but I'm curious, any words of wisdom for this individual?
I find with long-term care insurance, it is a matter of really getting a lot of, you can get information, like you can have your doctor write certain things, or maybe an assessment by a nurse saying that the reason, they're managing with a sponge bath, but they really need a bath with somebody there supervising them. There's usually a list of all the activities of daily living, and you have to meet 5 of the 7 or 6 of the 8 or something like that. If there's any cognitive impairment at all, that counts more towards being able to get the long-term care insurance activated. So sometimes I've had to appeal the rejections a couple of times and have, get another capacity evaluation or get another nursing assessment. If you're using an agency, the home care agency will do an assessment which says this person needs help with brushing their teeth, preparing a meal, getting dressed, hands-on personal care. They might find some, appealing it and reapplying again.
Those are all things that we can help, agent. I mean, we've done that too. We've had people call and say things like that, and it's, you know what? Let's jump in and start fighting for you to get these benefits to kick in. You paid for them. You selected them.
If you've got long-term care insurance, this is just a great argument to, and instead of doing it yourself and making all those phone calls, maybe reach out to a care manager. The other thing that I would say is that, if you've got it in your budget and if you're aging in place at home with that walk-in tub, it's worth investing some money to have an accessible shower in your home, and that investment will make it better for you. But also, you still might need assistance with bathing, but it'll be much safer and much more enjoyable.
And it's also
the way things are being developed. There's walk-in tub doors, and there's even now where it positions out, you can slide in and slide out. I mean, the way things are progressing so fast, and so it can fit every budget, because not everybody has the ability to tear their tub out and put in fancy tubs. There's different equipment that's being developed all the time that can really help people in that situation.
Great. Man, we burned through this hour and I wasn't even here for the whole hour. I love these, and we've got one more before the conference coming up next month, folks. But any last words of wisdom? Did anybody want to share something and didn't have the opportunity? And just to remind everybody, I'll get this recording up later this afternoon. It'll have all the chat. It'll have everybody's contact info, and you can feel free to reach out.
If anybody didn't get their question answered in the chat, I'm sure Steve will put our contact information. Happy for you guys to shoot me an email. Somebody put something about initial assessments. I'm happy to answer questions or.
Yeah, that's what I was going to say. If something wasn't answered,
well, I mean, if y'all want to hang on, I just saw that one came in on the initial assessments. That maybe briefly, just what does that look like? I know that most of the care managers, you can call them up and at least talk to them for 15 minutes or so without being charged. And then I imagine that leads to an assessment.
Usually the consultation over the phone about what is a care manager, what is their current problem, and then, an assessment is done in person with us anyway. Unless the client lives like somewhere else and they're moving them here, that's more of a consultative thing. But if we're going to be working with them, it's in person. We get to meet you. We see where you live. We'll look at medication list, past medical history. We do like a physical assessment. We're not checking blood pressure, but just to see where you live, and we can see a lot. We can glean a lot of information from that in person. For us, it's about an hour to an hour and a half, and then usually another chunk of time, an hour to an hour and a half on the back end of us formulating a plan, getting all your information into the system, and then regurgitating back to you. This is what we see. These are some recommendations. Either, everything's great, or let's work on, you need to go to the cardiologist, the doctor, all these different kind of plan, and how involved do you want us to be?
Julie and Jessica, is that pretty similar for the most part on your organizations?
Yeah, I think yeah, it is. And I think it's really important. It's great to have that in-person connection because it's always different than, being in 2D as we are now, but just seeing what their hopes and desires are and then connecting with if there's other family members that are involved and getting their point of view so we can really make sure that
I'm
everybody's
just going to edit
aligned
it.
on the same page. So that's another aspect. But for us, if we happen to be helping out in some financial, we don't necessarily, the financial person doesn't have to be there in person, but really our care managers and nurse care managers, it's preferred, as Joanne was mentioning. Yeah.
Great. Well, y'all, this has been a lot of fun. It's been great, and I'm thrilled that I was able to jump in and out, and the show still went on. That makes me feel really good.
Thank you,
Thank
Sean.
you so much, Sean, and thanks to the three of you. But
Thank you.
I have to say our audience is awesome. I love seeing the questions, and these are just such thought-provoking and informative discussions. So we'll get this
There are
recorded
so
now.
many resources in the chat as well that people were adding. So
I love
take
it.
advantage of all those. People answer the questions within the
Yeah.
group. So really awesome.
I'll get that up as quick as I can. So thanks everybody, and we'll see you at the next
Thank you.
one.
All right.
Thank you.
Thank
Thanks,
you.
everybody.
Bye-bye.